Good morning, everyone, and welcome to the first live surgery of the day. My name is Julia Andrei, and I will be the moderator for this session. It is my pleasure to present you the amazing team of surgeons from the County Clinical Emergency Hospital of Sibiu. We would like to express our gratitude to Vicentiu Saceleanu, Dr. Vladimir Rosca, Dr. Liliana Boca, and resident Dr. Josip German that have so kindly accepted to present us a fascinating surgery and explain it to us further. Dr. Vicentiu Saceleanu is a successful neurosurgeon, the head of the neurosurgery department at County Clinical Emergency Hospital of Sibiu and at Lucian Blaga University of Sibiu, and vice president of the Romanian Society of Neurosurgery from 2018. Beside his numerous publications, Dr. Saceleanu has initiated in 2018 a neurosurgery summer school, an innovating Erasmus Plus program that brings together neurosurgeons and bioengineers, as well as residents and students from Romania, Italy, and Spain. Before we start the surgery, the doctor has agreed to introduce us to this one-of-a-kind project through his presentation, Brain IT, Brain Rebuilt, Innovative Technologies in Neurosurgery Studies, whose author he is, and that will be further explained by Dr. Josip German.
Hello. On behalf of my headmaster of the Department of Neurosurgery, I would like to, as you heard, I would like to announce this fascinating program, a new approach in teaching and learning neurosurgery as a Erasmus program, Brain IT. This program is partnered with the Universidad de Las Palmas from Spain, Università Nicolo Cusano from Italy, Lucian Blaga University of Sibiu, and the Emergency Clinical Hospital of Sibiu. As collaborators, and to Saceleanu, professor with his research activity, skills and expertise on traumatic brain injury, neuro-oncology, and other pathologies from the neurosurgery field. Dr. Mario Monzon, Doctor of Industrial Engineering and professor at Universidad de Las Palmas, and Dr. Ilaria Cacciotti, professor with relevant research expertise and well-documented skills regarding synthesis, processing and characterization of materials. Also professor at Università Nicolo Cusano from Italy. Among with headmasters, we have the implication of the Students Surgical Society from Romania, the Sibiu Student Neurosurgery Circle, the Hippocrates Student Society for Medicine. And in the last years, technology in neurosurgery is progressing much faster than a regular medical department. Neurosurgery is also the branch of surgery that involves the highest accuracy amongst the other specialties. The participation in international workshops is still a big financial challenge for resident doctors and physicians. And at least but not last, the neurosurgery is not included in the curricula of most bachelor programs in medicine. The whole project aims to employ the strategy, use of ITC technologies in teaching or training activities among the students, to create an interactive teaching aids for students using 3D technology, 3D reconstruction of the skull in various pathologies, create a reader-friendly online platform which can facilitate the access to all students, residents, and practitioners to the new technologies and new discoveries in neurosurgery, to make a closer connection between European neurosurgery centers. And last but not least, 14 days traineeships in a working hospital where the course participants will get to real life working experience accompanying the whole diagnostic process. This priorities, or the project priorities, are especially developing skills for medicine students, developing the curricula relevant to the labor market and social needs, open education and innovative practices in the digital era, contributing to innovation, supporting the transfer of latest research outputs back into the education. There are 5 pylons on which this project sustains. On short, we have an e-learning platform for telemedicine, training materials, the summer program, the handbook, and the dissemination of the information. Now, the first pylon is the e-learning platform for telemedicine. This platform will be the technical and is the technical support to provide an open online course in all the topics addressed by the project in the field of neurosurgery and biotechnology. It will contain at least the following features: some streaming functionalities for the telemedicine applications showing the surgical procedures, an important role concept allowing the visualization of different types of content depending on the role of the user has to implement. Some Web 2.0 features as discussion forums for the students, chatting functionalities, Facebook and Twitter feeds, some e-learning functionalities, and a new network feature allowing users to work together on different tasks and topics. As you see, this entire program and the procedures that will be held on this program will be held in a fully equipped OR in the neurosurgery department of the Sibiu Hospital. As you see, this OR is fully equipped at the European standards. We are moving to the next pylon of this project that training materials. As you will see in this video, we'll have a scope head holder all in real search as the diagnostic process. This will be provided via the platform, the e-learning platform, as I discussed earlier. This will be done in the first year, and then it will be updated yearly, 4 months in advance of each summer school, because the thematic of each summer session is different, which requires new research and updated elaboration. The third pylon is consisted by an intensive summer program that will be held on a 3-year span. In the first year, we approached the neurotraumatology, in the 5th for the 28th of July 2019, in which there were 20 participants, 10 from Spain, 4 from Italy, and 13 from Romania. The next year, in 2020, was themed as neurovascular surgery, but as you know, because of this pandemic, was postponed. The entire conference, the entire summer session, was postponed in the 3rd year, where we are also approaching the neuro-oncology. So in the 3rd year, in 2021, we will have 2 weeks of neurovascular surgery and neuro-oncology. The entire intensive summer program will be based on workshops, different workshops of students that will be approaching various pathologies of the neurosurgery field applied to that thematic, respectively neurovascular and neuro-oncology. A theoretical study upon every pathology that we will study there, personalized guidelines in conformation and concordance with the general guidelines from the neurosurgery programs in EANS and AANS, treatment options and management. You will see that the students and the participants will be tasked with the entire diagnostic process of the patient from admission to the hospital toward the procedure and then the follow-up and the management, the therapeutical management. This will be always supervised by the medical team of the neurosurgery department. There will be also case presentations of the patients that were operated and hands-on sessions. The last intensive summer program and the first also in 2019 was based on the anatomy and physiology of the central nervous system, some physiological aspects of the central nervous system. Then we studied the modern techniques of medical imaging, the examination of brain and spine, traumatic brain injuries, various types, various etiologies, the treatment options, indications, and management regarding the TBI, the pre and post surgery management of the neurosurgical patient, application of biomedical engineering to neurosurgery trauma, and also a whole week of hands-on intensive program, like basic surgical skills, such as under microscope, anastomosis on 3D printed artificial vascular models, nerve coaptation, 3D printed brain surgery as approaches, craniostomies, cranioplasties, craniectomies, hands-on 3D printed brain surgery of trauma. In the last day of the intensive summer program, we had an overview of the entire program and evaluation of the students. As we will see in these next images, we have the hands-on courses, searchers under the microscope on different tissues, 3D printed tissues, perfecting their skills. The students are also conferences with the full participation of the entire circle of students and participants in the intensive summer program. You see here every student, every participant has a 3D printed skull on which he can train and learn how to perform different procedures, also different also every participant has a microscope. As you saw in the last image, there were the students were evaluated on the last day. All the students took the test, and the feedback was very positive from their point of view. We see here also another hands-on technique on the suture under microscope. Okay. Next, the next pylon, the fourth pylon, of imprint and online on the Project E platform, which will comprise all the important information delivered during the 3 years project. In our case, the 2 years, because I explained that the second year was postponed in the third year in 2021. The newest surgical techniques in neurosurgery will be also demonstrated and evidenced in this handbook. This will be structured in two layouts, one for students with less details and more illustrations, and one for the practitioners where they can read the surgical approaches and the techniques presented during the summer schools. This will be freely available to anyone interested. And at least but not last, the fifth pylon is consisted by the informational dissemination. This is a very important aspect of this kind of project nowadays. This started with a kickoff meeting in Las Palmas in November 2018 that discussed the objectives that will be aimed in the next session, in the traumatology session. The next kickoff meeting was in Rome in October 2019, that discussed the objectives for the neurovascular session that cannot be held because, you know, the pandemic. And this project is a multiplier event aiming to gather a large group of stakeholders, national and international, in order to disseminate the project results. The venue of this meeting will be in Sibiu, hosted by University of Lucian Blaga, Sibiu, with a partnership of the clinical hospital of Sibiu. They are expecting approximately 200 participants, 30 from foreign countries, in August 2021. For more information, please visit us on the project page on Facebook, Brain IT, Innovative Technologies in Neurosurgery Study. We are grateful that we could present this project, and we thank you for your attention. Thank you.
Thank you very much, Dr. German, for this amazing presentation and for sharing with us this one-of-a-kind project. We all found it very interesting.